So you can improve your lower eyelid bags without having lower eyelid fat removed non-surgically with zero pain and no downtime. Caveat, 10% of patients can get a shiner. Lower eyelid skin is very thin and delicate, and if the tip of my needle gets into a little vein by the eyelid, a purple mark can ensue. So whenever anybody wants to proceed with dealing with lower eyelid bags and camouflaging them and improving their appearance, I like to make sure that there's no important events happening, or at least they feel lucky that day that they're not going to get a bruise. In my view, I rarely remove lower eyelid fat anymore. And so things have changed a lot since my fellowship in 1998. In 1998, everybody with lower eyelid fat bags had their fat bags removed. And the current concept is that removal of lower eyelid fat bags can lead to a very hollow operated appearance, and I agree with that. So I figured I'd start the demonstration with the worst eyelid bags you can imagine. And my patient would benefit from an upper eyelid blepharoplasty, but his main concern were the appearance of these large protruding lower eyelid bags. So instead of removing the eyelid fat, which would cause the skin to prolapse inward and cause an increase in the wrinkled appearance of the lower eyelid skin, what I do is I inject the groove. I start at the corner of the eye and I inject the groove underneath the bag, around the fat, up to here. This result was after 3 treatments, and the area that I fell a little bit short is out here, and that's logistically, I start off medially by the nose. And you know, when I get around over here, sometimes I don't have enough silicone left in the syringe. So he's a little bit undercorrected out on the sides over here and over here. But you can see that the lid bags have not been removed, but they're blending more harmoniously into the cheeks. So it's a more youthening appearance. This is one of my African American patients. I injected him many years ago. Very prominent bulging lower eyelid bags with a prominent groove in between the cheek fat and the lid fat, and by injecting this groove around the lid bag, it doesn't make the bags disappear, but it lends to a more youthful, natural looking appearance where the lid bag blends more harmoniously into the cheek. This is a more typical patient, 30-something pushing 40, lower eyelid bags. Don't remove them. Fill in the groove underneath them. It allows the bag to blend better into the cheek, and it's a more pleasing appearance. And this patient I have marked because with the precision with liquid injectable silicone, I can correct defects in somebody 20-something who's got a congenital, mild lower eyelid hollowing. I'm showing you the markings and the before and after slide is here. There's a very, very slight hollowing over here and over here that bothered the patient. So after filling that in with a very small amount, about 1/10 of a cc of silicone to each eyelid, you can see a nice improvement in the appearance of her eyelid.